How accessible would you say women's healthcare is today?
That's a difficult question. It depends on where we're talking about.
Meet Anna. She is from East Lansing, Michigan. At 25 years old, Anna enjoys spending time with friends, shopping, and going to concerts. Hailing from Paris, France, meet Susie. Also 25 years old, Susie enjoys quiet evenings, reading a good book, running half marathons, and going to yoga. Although our new friends have different interests, they are both in need of the same thing: comprehensive access to women's health care. Anna and Susie ask their friends what they think of their country's healthcare system. We hypothesize due to universal healthcare coverage and a robust public transportation system, Susie will have an easier time obtaining effective healthcare coverage. Availability coverage reflects what resources are available and in what amount. This includes factors such as the number of health facilities or pharmacies in an area, hours of operation, and availability and price of drugs. Accessibility coverage measures how physically accessible resources are for the population. This includes resources which might be inconveniently located or hard to reach via public transportation. Let's hear from an expert on what are some major factors affecting accessibility for women.
It depends on where we're talking about. If we're talking about places such as New York City, Los Angeles, San Francisco, I would say it's really accessible. But for much of the country, it's not. For example, in areas in the South, it's not accessible at all. If we're talking about rural areas, not accessible, especially when it's compared to more urbanized areas or even suburban areas. So I think we have I know we have a long way to go before before women's healthcare is accessible to all women.
Let's follow our new friends to find out just how effective their healthcare coverage is. First, Anna and Susie are looking for emergency contraception. Anna heads to the nearest drugstore while Susie walks to her local pharmacy. There are 48 drugstores in the Lansing City, 2 of which are open 24 hours. In Paris, there are 98 pharmacies, of which 17 are open 24 hours. Although there's a higher quantity of pharmacies in Paris, there are actually more per square mile in East Lansing. Starting from the city center, Anna walks 350 feet down the street to a pharmacy, while Susie walks 3 times that distance to get to hers. When she arrives, Anna is shocked to find that her emergency contraception costs $50. Susie pays just a fraction of that price at €7. Though the drug's availability was greater in Paris due to its inexpensive price, it was not as accessible compared to that of East Lansing, where there were nearly twice as many pharmacy locations within a square mile. The United States has a free market insurance system in which 61% of Americans receive their health insurance through their employer because group plans tend to be less expensive. About 84% of the population has insurance, 26% public and 70% private. Nearly 42 million, or 1 in 5 Americans, are uninsured. France has a somewhat two-tiered system in which all French residents are required to have health insurance. The money for this insurance is taken directly out of their paycheck like taxes, and there is no opportunity to opt out, which makes it cheaper for everyone to have health insurance. Annual per-person spending in France is about $3,300. In the US, it's about $6,400. About 90% of the population decides to purchase supplemental health insurance, on top of the insurance that they must buy, which is based on their occupation, but consists of the same basic framework as every other baseline plan.
insurance companies are not allowed to compete with each other by lowering premium rates. Overall, nobody is uninsured in France, as there are systems in place to provide and pay for health care for those ineligible for insurance.
Planned Parenthood is an indispensable resource, especially in the United States where we lack universal health care insurance. The majority of those who use Planned Parenthood in the U.S. live in communities that are underserved or low income. Planned Parenthood is the largest provider for low-income women, and 40% of their patients, their sole healthcare provider. The services range from sexual education, STI testing, pap smears, to prenatal care. They also offer a range of services to the LGBT community, as well as services for heterosexual men. These services can be accessed by those without insurance or who cannot get them elsewhere. Planned Parenthood is often fighting against defunding from those who mistakenly believe that tax dollars fund abortions, which make up 3% of Planned Parenthood services. However, since the Hyde Amendment of 1976, no federal funding can legally be used for abortions. All federal funding for Planned Parenthood is used for the plethora of other services they provide.
Planning familiale in France is different, as they do not provide healthcare services like Planned Parenthood.
There is not as much of a need because of the universal healthcare system.
Instead, they are a resource to increase accessibility by connecting patients with healthcare providers and providing sexual education. Sexual education is required to be taught in French schools, and it must be medically accurate, unlike the abstinence-driven sex ed in the United States that varies state to state. Based on the many other ways to access healthcare for women in Paris, planning familiale is not as vital a resource as Planned Parenthood is to those in the United States.
Transportation is a key factor in determining accessibility for both rural and urban women. Curious to see just how easy it is to travel to Planned Parenthood and Planning Familial, we followed Anna and Susie to see where their journey took them. To get to her local Planned Parenthood, Anna first learns that it is located in Frandor Plaza. She arrives at a bus stop and reads the map to learn that the number 1 bus goes straight there. Boarding the bus, she pays $2.50 for a round-trip ticket and rides for 10 minutes until arriving at her destination. Easy enough. Now, let's follow Susie on her quest to reach Planning Familial. First, she determines the center's main location via the Planning Familial website. At 12:15 p.m., Susie enters the metro station for the RERB at Cité Universitaire. She pays €190 for a single ticket and travels 5 stops to the Châtelet station. Here, she pays €190 for another ticket to ride the RERA for 1 stop. Next, Susie must walk 0.7 miles to reach the address 10 Rue Vivienne, Paris. The trip took her 50 minutes. But wait a second, what the? Susie is shocked to find that 10 Rue Vivienne is now an optical store. Susie, exasperated, walks 0.7 miles back to the Châtelet station, where she pays another €190 to take the RERB back to Cité Universitaire. Here, she collects herself and plans to travel to the secondary Planning Familial location, 9 Villa d'Est, Paris. Paying €190 for a tram ticket, she rides to Port d'Ivory and disembarks. Now comes the real challenge. Wandering the sidewalk, Susie finds, by chance, a sign pointing in the direction of Planning Familial. She searches for another 10 minutes until discovering a small sign on the door of an apartment complex. Upon entering, Susie finds the lobby doors to be locked with a code that only residents know. About to give up, she is helped by a friendly tenant who enters the code and lets her in. Up an elevator and down a dark hallway lay a closed door with a small sign reading Planning Familial. Finally! Relieved, Susie reaches for the door until it doesn't budge. Closed? A small sign on the door showed the hours of the facility to be 10 to 5 Wednesday and 10 to 4 Friday, closing for the month of August. Exasperated, Susie leaves without receiving the services she needs.
Yet it cost her €9 and took 2 hours to complete. We were surprised to find that Paris has greater availability of care compared to East Lansing, but poorer accessibility for those in need. In Paris, the availability is extremely high due to a thriving universal healthcare system. Because the United States has such poor availability coverage, there is a great need for improved accessibility. This is why Planned Parenthood is vital to the United States, because it provides necessary care to thousands of women, improving accessibility throughout the country. Although each system has its strengths, there are definitely improvements that could be made in the United States and France.
Although all females are in need of comprehensive reproductive health care services, neither the United States nor France offer effective coverage for women. In order to achieve effective coverage for all women, strides must be made in both the United States and France. In France, improving accessibility via public transportation and increasing the number of pharmacies will create better opportunities for low-income women to access the care they need. In the United States, it is a disturbing fact that we must fight not only to improve availability, but maintain it as well. The movement to defund Planned Parenthood will have disastrous consequences, creating a rift in both accessibility and availability coverage and damaging any hopes of creating effective coverage for women.